Hi, good morning, everyone, and welcome to County Executive Pittman's virtual press conference. This morning, the County Executive will provide updates on the county's tornado response, COVID response, an executive order on equity, diversity, inclusion, and other items. We'll take questions after. As a reminder, please put your name and media affiliation in the chat, and I'll call on folks for questions in that order. Additional reminder, please keep your microphone and camera off unless you're called on to ask a question. With that, Mr. County Executive.
Thank you, Jeff, and thank you, everybody, for joining us. Hope everybody had a restful Labor Day weekend and remembered the contributions of organized labor in the history of this country, and thanked those who had to work on Labor Day. Also, Rosh Hashanah began last night and continues through tomorrow night. And so I want to wish a happy new year to all who celebrate Lashana Tova. I want to get Preeti Emmerich from Director of our Office of Emergency Management to give you an update on the damage assessment and the beginnings of after action thoughts on the tornado response. I am here at the Office of Emergency Management this morning to thank the staff for the incredible work that they did. And I have to say that having sat through some of their sometimes hourly briefings during the tornado with all of the departments that were activated there, everybody in an incredibly efficient way, making their reports and letting all of the departments know, as well as our state partners and our partners in the city of Annapolis, what the needs are in the moment, moving them quickly. The coordination of the response was masterful. So I want the general who coordinates that to speak to us. And but also just to say that not only did local government departments do amazing work, but that folks in the community stepped up as well. And I will never forget being in Edgewater, where the tornado had come through, gathering with neighbors and hearing stories, particularly seeing neighbors on a roof hammering tarps down to an elderly man's home where the shingles had all been stripped off of the roof, going back the next day and the day after, and hearing how people felt about the response and whether they needed more. The DPW crews were out there all night long, working overtime, brought in from all the other districts. I spoke to them on the site, and then I was out there this morning at another event that we had for road cleanup, hearing more about the experience and how appreciated it was. Inspections and permits was making it possible for people to get back into their homes in some cases, letting people know what the damage was, whether their homes were going to be likely inhabitable, likely salvageable. Their quick response and being out there was essential, and then working with the team in the city of Annapolis with the mayor and their Office of Emergency Management. Everybody in the community and local government came together, and state government, walking around with the governor. People care, and people build relationships during times like this that last a lifetime. So that's the silver lining in the cloud anytime something like this happens. But I do want to turn it over to Preeti quickly and have her brief us on where things stand in terms of damage assessment.
Thank you, County Executive. Good morning, everyone. And I just want to echo the thoughts that the County Executive has expressed very eloquently. It takes a whole community approach. So I want to thank the county agencies, city agencies, and of course the nonprofits, the neighbors who have all helped us respond and recover from this tornado. So the Office of Emergency Management, along with our partners in inspections and permits and the fire department, have been doing some damage assessments of the affected areas. And here are some initial damage assessment numbers. So we use the FEMA criteria in doing some of our damage assessment. So 80 FEMA individual assistance surveys have been completed. 24 sustained minimal damage, and that means damage to things such as siding or external structures such as a carport. 25 sustained minor damage, and that's damage to shingles, small cracks in the foundation, things that are fixable. 26 sustained major damage. So that's damage to the structure of a building, such as the roof or an exterior wall. So 5 are completely destroyed. And that means 2 or more exterior walls are damaged, the collapse of foundation, or nothing is left other than the foundation. So in total, there are 19 homes that are uninhabitable, which includes the 5 that I mentioned before that were destroyed, and 14 of the homes that sustained major damage. I also want to really thank our Health and Human Services agencies who have done incredible work with the families. We've had some individuals and families assisted by our Department of Social Services. Again, talking about the whole community approach, there have been local nonprofits and churches that have helped with the sheltering as well. And of course, our crisis response team and the police department have been extraordinary in their community ties and their community outreach to individual families. Power outages are back to normal day-to-day numbers. There are 8 currently, and that was actually post-storm power outage numbers. There is one road that is closed for scheduled maintenance, Mill Swamp Road, that has really nothing to do with the storm. So a lot of the road closures and the power outages are back to normal day-to-day operations. The DPW is still out there cleaning up the debris. And I would like to say that September is National Preparedness Month. We have learned a lot, obviously, from the tornado, and it's really important for communities to make sure that they understand a disaster response and recovery, and to have the resources, obviously, and able to be completely prepared for it. So the Office of Emergency Management social media and website, please tune in for updates, tips on how to be prepared, how to efficiently respond and recover. And we're going to be having events all throughout the month for that. Oh, and one more thing, our damage assessment portal, I said these are preliminary numbers. If you go to the county website and also to the Office of Emergency Management website, you will find our damage assessment portal. Please, I encourage all residents to log in. It's a very simple form to complete. You can upload pictures, fill out the form on what damages occurred to your residents. And if you're not able to reach a computer, please call 410-222-0600, and we can take down that information as well. Thank you.
Thanks, Pretty. And I wanted to note that we also have on the call for when we get to questions, Mitchell Stevenson from the City of Annapolis, as well as our partners, our fire department, police department, and others. So I will be, we should note though, and I think it's been, hopefully folks know by now, Wednesday evening at Mount Olive Church in Annapolis, 5 p.m. to 8 p.m. Will be a town hall. 5 p.m. I think is when residents can start to meet with staff about their individual situations, and then 6 p.m. I and others will be there to lend our support. And then school's back this week. And I know that I've been around at a lot of schools at ribbon cuttings for new schools in the last week, and talked to a lot of teachers and administrators. And I think particularly the teachers are very excited to have kids back in the classroom. Looking forward to this. I've also talked to parents who are nervous about the spread of COVID as well as the flu with their kids back in school again, and concerned about what is being done, what will be done. Will this cause a spread, an increase in infection? So we do have Dr. Kalyanaraman here who will say a few words about back to school, COVID, and I assume the flu, and encourage everybody to get back to both, please, as soon as possible.
Thank you, County Executive. Yes, so with COVID, starting as we do with our data, we see that our hospitalizations have climbed up to about 60 between the two hospitals, Arundel and Baltimore Washington Medical Center. Our case rate is up to 20. I think most critically is that we've also seen the number of deaths increase in the past 3 weeks. So a total of about 15 deaths. And that number, of course, gets revised as we learn more in the coming weeks. The key take home here is that the deaths are almost exclusively in those who are unvaccinated. It is rare for somebody who is vaccinated to die. And that's why we have focused and will continue to focus on people getting vaccinated. But that's not the only consequence of COVID. We also know that People who are vaccinated can get hospitalized. It is much more likely if you are unvaccinated that you'll be hospitalized than if you are vaccinated. But because Delta spreads more easily and causes more severe disease, we do see some hospitalizations in those who are not vaccinated. So it's critical to get your vaccine to decrease your chances of both getting hospitalized, and also it turns out long COVID, those lingering symptoms are much less likely in the vaccinated as well. So there are a lot of good reasons to get vaccinated. That said, we're seeing the spread. We're seeing more people get tested, and we want to encourage people to get tested. I think we all remember, if you've been in a gathering, if you've been with others, others who are not masked in large settings, if you've been exposed to somebody who has COVID, and of course, if you have any symptoms, please go get tested. That's how we're going to decrease the spread and get a handle on this. Of course, school is starting. School is opening tomorrow. There's some key things that families, students, teachers, staff can do just for keeping kids healthy and in school. If you haven't already, get vaccinated. That's particularly true for our students who are eligible, those who are 12 and up. We have a pretty good vaccination rate of about 63-64% of 12 to 17-year-olds, but pretty good is not what we want to get. We want to do we want to get a great response. So we want to see more kids getting vaccinated, and we suspect that will be happening as school is reopening. The other piece is wearing a good mask. So either a surgical mask or a cloth mask with multiple layers and a filter, and making sure that it covers your kid's nose, mouth, and the sides of their face. That's going to be critical. There's a lot of excitement and anxiety as school is opening for the first time fully in 18 months. And that anxiety, we all feel it. And so I think it's really important for parents to set a positive tone for your kids as they head back to school, giving your child the tools, the knowledge, and the supplies they need to decrease their risk at school. And of course, as a parent, staying engaged with your kids, staying engaged with your school. But the other piece is mindful of activities outside of school. So we talk a lot about the prevention strategies in schools, masks, ventilation, cleaning, testing, and a whole range of other strategies. But at the same time, making sure that you're maintaining that level of diligence outside of school is going to be really important. So staying masked in indoor public settings, avoiding large gatherings, getting tested if you've been in situations outside of school where there are a lot of people gathered or you may have been exposed. Because ultimately what you do outside of school also impacts directly on keeping kids safe and keeping kids and staff safer in school. Along with that comes, as every parent knows, once school starts, all of a sudden the colds come right behind them. And so it is cold and flu season. One of the key things you can do is get your flu shot. That has always been true, and that is even more true now. As a side benefit with masking in school classrooms, we should see fewer colds and flu, but that flu shot is going to be critical to keeping that down and decreasing just the number of times people have symptoms and that they got to go get tested. And so please get your flu shot. Those should be available in pharmacies starting now. And it's really important to get those before we get into the thick of cold and flu season in November and December. And so with that, I will turn it back over to you, County Executive.
Thank you, Nilesh. During normal times, this probably would have been our lead and our primary news for you all, that I signed last week an executive order number 50, titled A Commitment to Equity, Diversity, and Inclusion. And it's not news that Anne Arundel County and this administration have been very serious about making Anne Arundel County the best place for all, and that we have been working to confront the failures of our history and the racism and the structural racism that has led to the disparities that we have today. But we created a diversity council among our staff, and every department is represented. And that council set forth recommendations. And the first of those recommendations was that we do an executive order so that it would stand until a future county executive made a decision to remove it, which I think is, I hope, unlikely. An executive order describing what we mean when we say that Anne Arundel County government is committed to promoting equity, diversity, and inclusion. So I'm going to read not the whole thing with the whereases. You can access that, but I'm going to read the now therefore section of this executive order. Number one is, I affirm Anne Arundel County's commitment to promoting equity, diversity, and inclusion as the guiding principles and core values for every county workplace, program, activity, contract, and decision. Anne Arundel County, this is number two, Anne Arundel County is committed to promoting equity, diversity, and inclusion by addressing the legacy of policy inequities within our communities, government departments, services, programs, and workplaces. The county strives to use an equity lens to ensure discrimination of any kind is not supported or promoted as a consequence of government initiatives and policies. Our goal is to make our county the best place for all by staffing a workforce that reflects the diversity of our residents and promotes a workplace culture that embraces individual differences, and by honoring the importance of equity within our business communities. So we created a position called the Director of Equity, Diversity, and Inclusion, and hired Pete Hill as that director. And I'd like Pete to say a few words about what he's doing to implement this executive order.
Thank you very much, County Executive. What we're doing to implement this plan is creating a countywide EDI strategic plan that we hope to roll out before the end of this year. But the key to that success of that plan, whenever it comes out, is executive leadership. And this executive order definitely indicates that our county executive supports whatever it is we ultimately decide to implement. And so I want to thank him for taking the lead and issuing that executive order, because without it, it makes my job that much more difficult. EDI only succeeds when leaders take the lead. Thank you, sir.
Thank you, Pete. So I started the morning picking up trash by the side of the road with our partners at Maryland Department of Transportation and Anne Arundel County Public Works. And it was the launch of 3 days in which we are doing what we call a clean sweep with the state. We're piloting this program in the northern and western part of the county. And we will have 4 crews from Public Works focused in the area, as well as the state will have crews. They will do state roads, we will do county roads. But by having it happen all at once and getting things looking better than they have looked in a very long time, our hope is that residents will notice and respond by keeping their trash in their vehicles, putting them in the appropriate receptacles, and doing their part, and even picking up trash when they can to keep it that way. We'll be continuing to do this clean sweep either 3 or 4 times in the next year. We will do it as well in other parts of the county, but it's an important partnership. It was initiated by Senator Bidel in conversations with our state partners, and our Department of Public Works is all in to clean up Anne Arundel County and make it truly the best place for all. Upcoming, the only thing that I want to mention that is of significance, of major significance, is 20th anniversary of the attack on our country by terrorists. 9/11 is coming up this weekend, and I will be at our memorial, our 9/11 memorial at the Anne Arundel County Police Headquarters in Veterans Highway in Millersville. Anybody who has not seen that memorial, this would be a good time to go there. We'll do a wreath laying ceremony with our police chief and our fire chief and a lot of our first responders at 9:30 in the morning on the 11th. So with that, over to you, Jeff, for questions.
Thank you, Mr. Executive. First question, Brian Sears, Daily Record.
Mr. County Executive, I wanted to ask, last week, one of your colleagues in Montgomery County had publicly made a call for vaccination passports for businesses, saying that that would help drive down the risk of the unvaccinated transmitting to people who have been vaccinated, and also perhaps help promote businesses. And I was wondering if you had a thought on that, and do you think that that is a policy that you would support in Anne Arundel County?
We are in conversations right now with a vendor and hope to have a contract soon to facilitate these kind of mandates by businesses, to make it less burdensome on the businesses, so that people's vaccination status, as well as their testing status, if they're trying to comply with a mandate that requires testing in a certain number of days before an event or before a certain kind of an activity. So we'll have an announcement about that shortly. And as you know, we've been going through this process with our county staff of getting folks vaccinated, vaccine requirement, incentives as well to get folks there. And I'm working with our chambers of commerce as we speak. My staff is working to set a date for a town hall meeting with business leaders, government leaders, nonprofit leaders, employers, really, to discuss the challenges that they face in getting their workforce vaccinated, and in some cases, their customers vaccinated, so that folks feel safe. So, yes, we are working towards creating the passport system so that these kinds of things can be implemented.
And a second question, if I might, for Dr. K. My question relates to hospital capacity. And in the last couple of weeks, we've started to see that the state is closing up and pulling back some of the tent facilities at hospitals. I believe Anne Arundel Medical Centers decreased by 56 convalescent beds, and we've seen a number of other hospitals around the state. Are you confident that the hospitals in Anne Arundel County have the capacity if this level of cases that we're seeing now is not the peak of a surge?
So yes, I'm confident that they can handle if we see more COVID cases, that they'll be able to handle that. I think what our discussion always has been around is if that level goes too high, then they start having to make decisions around deferring some care that is not as urgent. And that's what we don't want to get into that situation, because all of that care is important. And that's why we're paying so much attention to what the hospital census is at this point, is to not have them have to make choices like that.
Are you concerned about the fact that the tents, that these auxiliary units are being removed?
No, I'm not. The big issue with hospital capacity has to do with staffing, and they've been working really diligently on that. The space piece, I don't think that we really anticipate the need for all that extra tented space. There is space within the hospitals, and we have conversations with them regularly about both their space and their staffing. So I feel confident about how they're going to be able to handle that if they see an increase in cases.
All right, next up, we've got Joel McCord, WYPR, a question for Mitchell Stevenson.
Thank you. Mitchell, I'm wondering if the city has a damage assessment similar to the one that we just got from Treaty Emmerich for the county. I'm thinking of a house I saw on Forest Drive that had no roof. I'm thinking another guy told me his home was uninhabitable. And Chris's charcoal pit. What's going on with the businesses on West Street?
So I can see the dashboard. I just got a copy of that, of our damage assessment team. And I can give you the numbers of that. And I can actually, if I can screen share, I can send it all to you. But we have 5 destroyed, 29 suffered major damage, 46 suffered minor damage, 25 buildings in the city are condemned. And this says a total of 37 people are displaced. But you'll remember that some of those are businesses. So.
All right, next up, Kate Amara from WBAL.
Hi, thank you. I have two separate COVID-related questions. I'm wondering in terms of the vaccine and breakthrough infections among the vaccinated, Dr. K, do you have the numbers, the recent numbers, like in the last couple of weeks or within the last month, the percentage of COVID-19 cases that are that occurred in fully vaccinated people, the percentage of hospitalizations among the fully vaccinated, and the percentage of deaths, if any, among the fully vaccinated? I'm assuming that percentage of cases overall is higher than it was in the past, since you have a very high county vaccination rate. So if that is the case, I'm wondering if the number so far, or if you've been able to determine, is it because of Delta or the waning efficacy of the vaccine, or both?
So a number of questions in there. I'll start with the hospitalizations. What we're seeing are preliminary data for the past 3 months, during which time Delta has been the predominant strain, is that approximately 70% of the people who are hospitalized are either not vaccinated or partially vaccinated, and only 30% are fully vaccinated. And in that group, we're finding that it tends to skew older, and that it tends to be people with other conditions as well. The deaths, we rely on state data for the deaths, and what we've been finding consistently at the state level is that nearly everyone who has died from COVID is unvaccinated. Remind me, Kate, your other question?
In terms of the breakthrough infections and hospitalizations, do you know yet if the cause of that is the Delta variant, just because it's so sneaky,
Right.
or the waning efficacy of the vaccines, or perhaps a combination of the two?
You know, it's likely a combination, but I think the biggest part of it is due to the Delta variant, because when we looked at our data from March, April, May, when it was the Alpha variant, we saw it was rare to see anybody who was vaccinated get hospitalized. And so we know that the Delta is just causes much more severe symptoms. Now, there might be some piece of it that's attributable to the waning immunity. That's a little bit harder to pick apart, particularly since we've had a much wider period during which people got vaccinated. The study that you're referencing came from Israel, and they got their population vaccinated much quicker than the United States for a number of reasons, largely because of size. And so I would say Delta is the biggest reason for why we're seeing this.
Thank you. And my second question, it kind of piggybacks on Brian Sears' question, I think. We have been hearing anecdotally about issues regarding getting a COVID test. People from various walks of life and locations are telling me the over-the-counter test kits are sold out, like when they go to CVS to go buy one, or their PCR results are taking longer to get back. Are you able to speak to that in Arundel at all, if you know that that's happening? And do you have a recommendation for residents who know that they should be, get tested and are having trouble now? It's a problem we haven't had in a while, but I'm wondering if you're seeing it there, and what you would tell residents, what your suggestion to them is.
Yeah, so testing is still available. Pharmacies, urgent cares, doctors' offices, and health department all are doing testing. I think what you're seeing is that there are simply more people, and so people are waiting it a little bit longer than they were used to a few months ago. And we're seeing more capacity coming online for that testing to meet that additional demand. So it's available. I do know that the over-the-counter or the ones in the pharmacies are selling out. We understand that they're stocking more, and at the health department, we are looking to provide at-home testing. So we're working through the contracting piece for that as well. So more options are coming down the pike.
Thank you.
All right, thanks everyone. That wraps up our presser for the week. We'll see you all next week.